Hello everyone, in this video we are going to discuss about Streptococcus agalactiae. So Streptococcus agalactiae, it is a gram-positive cocci which is arranged in chains like all the other Streptococcus. It is beta hemolytic on blood agar, means it causes complete hemolysis of the RBCs. So it causes a narrow zone of complete hemolysis. It is also catalase negative like all the other Streptococcus. The catalase positive organism is Staphylococcus. It is Bacitracin resistant. Versus the group A Streptococcus, that is Streptococcus pyogenes, which is a Bacitracin sensitive. It is a group B Lancefield antigen. So we know the Streptococcus are divided based on the Lancefield antigen from A to V. So it belongs to the group B. Next is it is CAMP test positive. So we will discuss about this test later. So here in the CAMP test, it forms an arrowhead hemolysis with the Staphylococcus aureus, and the another important point is it is the heparin hydrolysis is positive in this Streptococcus agalactiae. So in this picture we can see there is a beta hemolysis on blood agar in Streptococcus agalactiae, and bacitracin disc whenever placed, whenever the growth is complete, like in bacitracin resistant cases, in the below we can see that is resistant because the growth is continuous, whereas whenever the organism is bacitracin sensitive, that is the antibiotic is acting against it, then the growth is inhibited at that zone of the antibiotic, that is we can see zone of growth inhibition. So the sensitive one is the pyogenes and the resistant one is the agalactiae. So coming to the CAMP test, CAMP stands for Christie-Atkins-Munch Peterson test. So here what we do is, first on blood agar we will streak a vertical streak of Staphylococcus aureus is done, as you can see in the picture, and we will do two streaks, that is Streptococcus agalactiae and Streptococcus pyogenes. We don't know what is it, so in order to differentiate between these two, what we see, we do two streaks of two different things. So whenever there is a Streptococcus agalactiae, it produces CAMP factor. This is a diffusible extracellular protein which is heat stable. So it synergistically acts with beta hemolysin of the Staphylococcus aureus. We know beta hemolysin is also produced by the Staphylococcus aureus. So this agalactiae which is producing the beta hemolysin, which will synergistically act with the beta hemolysin of the Staphylococcus aureus. So it enhances the lysis of the red blood cells. That's why in agalactiae we will see an arrowhead hemolysis, whereas in Streptococcus pyogenes we don't see that. So these can be done to differentiate the agalactiae from other species. So arrowhead hemolysis is important. It is seen in CAMP test. So coming to the virulence factors of this organism, it have a polysaccharide capsule which inhibits the phagocytosis. It have beta hemolysin, as we already saw in the CAMP test. So it contributes to lysis of the cells, and also it contributes to inflammations and tissue injury. Whereas surface proteins is help in adherence to the epithelial surfaces. Coming to the clinical diseases which are caused by this organism, it is the most common cause of neonatal sepsis and pneumonia and meningitis. So and it can cause intrapartum infections like endometritis and wound infections. Occasionally it causes urinary tract infection in adults. So coming to the neonatal sepsis, whenever the onset of the sepsis is less than 7 days after birth, it is early onset. After 7 days it is late onset. Early onset is acquired during delivery, that is colonized maternal genital tract, that is with the agalactiae, whenever it colonizes the tract, it causes this. Next, more than 7 days is late onset. It is maybe due to environmental or caregiver exposure. Coming to the diagnosis, it can be blood culture and CSF cultures can be done in neonates. CAMP test can be done, which shows arrowhead hemolysis. Heparin hydrolysis is positive. It is a beta hemolytic organism. On blood agar we can see complete hemolysis, and bacitracin resistant. And bacitracin sensitive one is the pyogenes. So coming to the treatment and prophylaxis, penicillin is the most common drug which is used. For serious neonatal infections, ampicillin along with gentamicin can be used. And for intrapartum prophylaxis, penicillin is used for whenever the person is positive for the group B Streptococcus in pregnant women who is screened at 35 to 37 weeks of gestation. So whenever we see a question, we have to always look for gram positive cocci which is arranged in chains, beta hemolytic, These two are also seen in pyogenes. So how we can differentiate it is with the Bacitracin test. Bacitracin resistant one is the agalactiae. CMP test is positive, which shows arrowhead hemolysis. Hippurate hydrolysis is positive, which hydrolyzes the hippurate into its compounds. Neonatal sepsis, most common cause, meningitis, pneumonia, screening at 35 to 37 weeks of gestation, intrapartum penicillin prophylaxis. So coming to the mnemonic, group B Streptococcus is Streptococcus agalactiae. So B stands for babies, B stands for group B Streptococcus, B stands for Bacitracin resistant, B stands for babies, which causes sepsis, meningitis and pneumonia. B stands for beta hemolytic, B stands for birth canal transmission, so causing early onset neonatal sepsis. So these are the important points in Streptococcus agalactiae.